Rumination is a prolonged, inconclusive, and unproductive train of thought that repeatedly revolves around the same topic. It reflects an inability to disengage from negative emotional and cognitive content, leading to cognitive rigidity. Although older psychiatric literature sometimes use the term interchangeably with obsession, modern psychopathology distinguishes different types of rumination based on their content, clinical context, and associated disorders. There are three major types of rumination that are important for university examinations. The first is obsessional rumination, which is seen in obsessive-compulsive disorder. The thoughts usually revolve around neutral, unusual, or philosophical questions such as, why is the sky blue, or what is the nature of God? These thoughts are ego-dystonic, meaning the patient recognizes them as intrusive, unwanted, and senseless. The patient actively resists them but is often unsuccessful. This type of rumination is commonly associated with mental compulsions or rituals that are performed to reduce the resulting anxiety. The second type is depressive rumination, which is characteristic of major depressive disorder. Here, the thoughts focus on past failures, regrets, mistakes, and self-criticism. Patients repeatedly think, I am a failure, or everything is my fault. Unlike obsessional rumination, these thoughts are ego-syntonic, meaning they are accepted as true reflections of reality. Patients rarely resist them, and instead remain trapped in a cycle of self-reproach. Research suggests that this repetitive mental rehearsal of negative memories predicts a longer duration and greater severity of depressive episodes. The third type is anxious rumination, also known as worry, which forms the core feature of generalized anxiety disorder. These thoughts focus on future uncertainties and possible catastrophes involving health, finances, work, or the safety of loved ones. Patients often believe that worrying helps them prepare for future problems, even though it ultimately increases anxiety. This type of rumination is driven by intolerance of uncertainty and an overestimation of risk. A useful way to differentiate these three forms is by remembering their time orientation. Obsessional rumination focuses on strange, neutral, or taboo thoughts. Depressive rumination focuses on the past, particularly failures and regrets. Anxious rumination focuses on the future and the possibility of catastrophe. There are also important special contexts in which rumination occurs. In grief, patients repeatedly think about the deceased and memories of the loss. In post-traumatic stress disorder, the thoughts revolve around traumatic experiences and their lasting impact. In eating disorders, patients become preoccupied with food, weight, and calorie counting. In Zimbabwean Shona culture, the syndrome known as kufungisisa, meaning thinking too much, represents an idiom of distress characterized by excessive rumination and associated physical symptoms. In insomnia, persistent thoughts about not being able to sleep often maintain the sleep disturbance itself. Management depends on the underlying disorder. Pharmacologically, SSRIs are considered first-line treatment for all three major types. Obsessional rumination often requires higher doses or medications such as clomipramine or high-dose fluoxetine. Psychologically, cognitive behavioral therapy forms the cornerstone of treatment. Exposure and response prevention is especially effective for obsessional rumination. Cognitive restructuring targets negative beliefs in depression and catastrophic thinking in anxiety. Mindfulness and acceptance-based approaches teach cognitive diffusion, helping patients observe thoughts as mental events rather than facts. Thought-stopping techniques may also be used, particularly in obsessional rumination. The key examination point is that although all three conditions involve repetitive thinking, they differ in their content and clinical significance. Obsessional rumination revolves around senseless or intrusive thoughts, depressive rumination centers on past failures, and anxious rumination focuses on future uncertainty. Recognizing these differences is essential because the underlying diagnosis determines the most appropriate treatment strategy.